Cardiopulmonary resuscitation training video.
CPR is a life-saving technique that's useful in many emergencies, such as a heart attack or near drowning, in which someone's breathing or heartbeat has stopped.
When a person suffers cardiac arrest, the blood will not circulate and the heart stops to function. They stop breathing and lose consciousness. Without oxygen being passed from the lungs to the bloodstream and then pumped around the body by the heart, the person will suffer irreparable brain and other vital organ damage and will die within minutes. To avoid such a situation, one must be given immediate first aid attention. Cardiopulmonary resuscitation, or also called as CPR, is a first aid technique that can save lives in such situations if performed correctly. Before commencing CPR, the following basic life support steps must always be performed. 1. Check to make sure there is no further danger caused to the rescuer or the casualty. 2. Check for response. Try to wake the casualty.
Tap the victim on the shoulders and shout, "Are you okay?"
Scan the chest for movement. If the casualty is breathing normally, place him in the recovery position. Wait for medical attention to arrive and monitor the condition regularly. 3. If the casualty is not breathing normally, raise an alarm. Get an AED, automatic external defibrillator, as soon as possible if available, or ask the ambulance to get one. 5. Meanwhile, check the carotid pulse for not more than 10 seconds. If you find the pulse, support the casualty with rescue breaths. If you cannot find the pulse within 10 seconds, commence CPR immediately. CPR is a combination of rescue breathing and chest impressions. It involves the compression of the heart between the breastbone and the backbone and supplying oxygen to the lungs by blowing into the casualty's mouth. Position yourself in a way that will allow you to apply vertical pressure during compressions. Visualize the center of the casualty's chest and place the palm of one hand on that point. Place the other palm on top of the first and interlock the fingers. Alternatively, you can also grasp around the wrist of the first hand. Either method is acceptable.
Proper positioning of hands on sternum. Use the middle and index fingers of your lower hand to locate the lower edge of the victim's rib cage on the side closest to you. Slide your fingers up the rib cage to the notch at the end of the breastbone. Place your middle finger on the notch and your index finger next to it. Place the heel of your other hand along the middle of the sternum next to your index finger. Chest compressions. Place the heel of one hand directly on the sternum and the heel of the other on the top of the first. Position your shoulder over hand with elbow locked, your arm straight.
Deliver 30 chest compressions at the rate of not less than 100 compressions per minute. Each compression should depress the chest 1.5 to 2 inches. After each compression, release the pressure completely, allowing the chest to recoil. After the 30 compressions, open the airway by lifting the chin and tilting the casualty's head backwards. Pinch the nostrils to close the nose and open the mouth with the help of the chin to give 2 rescue breaths. The 2 breaths should not take more than 5 seconds.
30 chest compressions and 2 breaths. Each breath should be just enough to create some chest rise. Repeat this cycle 5 times, which is approximately 2 minutes. Recheck for breathing. If no breathing, continue CPR. If breathing is present, roll victim on his side to protect his airway. Attempt to have a new rescuer performing CPR every 2 minutes as rescuers tire. Always have victim on a hard surface, not in a bed. Please note, victim may never regain consciousness.
If you arrive on the scene, check the scene for safety. Check the infant for consciousness. Gently tap the shoulder or flick the bottom of the heel and shout,
Baby, baby, are you okay? Are you okay?
Turn them onto their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position 2 or 3 fingers on the center of the infant's breastbone just below the nipple line. Compress the chest 1.5 inches in depth 30 times. After giving compressions, give breaths. Tilt the infant's head back slightly, using one hand on the forehead and lifting up on the infant's chin with 2 fingers with the other hand. Cover both the infant's nose and mouth with your mouth. Give 2 small, slow breaths, watching for the infant's chest to rise. Continue with 30 compressions, 2 breaths.
OPA or Giddle Airways. Indications: unresponsive patient with an absent gag reflex. Contraindications: any patient with an intact gag reflex. Pros: simple, non-invasive, and easy to place. Cons, that is disadvantage: risk of pushing tongue back and making obstructions worse. No protection against vomiting. Key points: sizing, angle of jaw to level of incisors. Check for foreign bodies prior to insertion. Suction if required. Invert, insert, rotate, locate. Be aware of gag reflex. Remove immediately if reflex intact. CPR is as simple as C. Compression 30 times, A. Airway, clear the airways, B. Breath 2 times. Repeat this cycle: 30 compression and 2 breath. Continue CPR until you see signs of life or until medical personnel arrive. CPR is stopped when the person is revived and starts breathing on their own.